enter the room.
Hello,
Good day, doctor.
I'm one of the junior doctors here in the GP clinic. Can I please know your name?
My name is Jennifer Oliver.
Okay, Jennifer, welcome to the clinic. And can I know your age?
I'm 48, doctor.
Okay, and what would you prefer for me to call you during this talk today?
I think Jennifer's fine.
Okay, so I can see from my notes that you have some concerns. Can you tell me more about this?
Okay, doc. My husband asked me to come see you because I haven't been myself.
Oh, I see. That sounds worrying. Can you explain to me exactly what you mean by you haven't been yourself?
Well, doc, I've been experiencing mood swings and general irritability lately. Sometimes I feel low and anxious, and I get these awful hot flashes and dizziness.
Oh, I'm so sorry to hear that. This sounds quite distressing for you. How have you been able to manage with these symptoms?
Doc, I actually have really been struggling. It's putting a strain on my relationship with my husband.
Okay, so I'm going to discuss your concerns in a short time, Jennifer. But I would like to ask you some questions so I can better understand the situation. Can I go ahead?
Yes, you can go ahead.
Okay, so you mentioned you've been experiencing some hot flushes, some anxiety, some changes in your mood. Is that correct?
Yes, that's right, doc.
Okay, and how long has this been going on for?
I would say it's been over the past 8 months. And I don't know if this is important, but I also haven't had my period in 8 months. Before that, my periods were irregular for about 2 years. I used to have a normal 28-day cycle without any problems.
Okay, and how many days was your period previously?
My cycle was 28 days.
Okay, so you mentioned that your periods have been irregular. Have you been on any pills, any hormonal pills or any contraceptives?
No, I haven't been on any sort of medication.
Okay, and have you been pregnant before, Jennifer?
Yes, I actually have 2 children, doc. One is 20 and the other is 18 years old.
Okay, and have you had your pap smear done by any chance?
No, I haven't had a pap smear, but I don't have any discomfort or any discharge in my genital area.
Okay, I'm going to be asking you some questions about your sexual life. They're a bit personal and may sound intrusive, but it's just to help us understand the entire situation. So can I go ahead?
Yes, you can, doc.
Okay, are you sexually active at the moment?
Well, my mood swings are sort of affecting my sex life. I honestly don't feel like I've lost interest really. I only have one sexual partner, and that's my husband. We've been married for the last 20 years.
Okay, and have you or your husband been treated for any STI?
No, doc.
Okay, so I also want to ask you questions about your mood. Can you grade your mood for me on the scale of 1 to 10, 10 being the best you felt and 1 being the least?
I'm sitting on a solid 3 these days.
Oh, I'm so sorry to hear that. Has this affected your work or your life in general?
Well, no, I'm trying to manage, but work is a bit stressful.
Okay, and what do you do for work, Jennifer?
I'm an administrative assistant.
Okay. And since you've been experiencing all the symptoms, have you tried anything to make them go away? Have you taken any pills?
No, doc. I haven't really tried anything, and that's also the other reason why I've come here for a solution.
Okay. I want to ask you questions about your lifestyle. Do you take alcohol?
I drink occasionally, maybe once or twice a month.
You take cigarettes?
No, I don't smoke.
And do you have any idea as to why you're experiencing all of these symptoms?
I think I might be going through menopause.
Oh, I see. And what do you really understand about menopause, Jennifer?
I've heard people say it's a time when you stop going on your menses and you start having all these uncomfortable symptoms. And I think the symptoms that I was told about, they sort of match what I've been feeling.
Okay, we're going to talk about this in detail. And is there something in particular you'd like for us to do for you today?
Well, I want to know if there are alternative medications for managing these symptoms. I'm really hesitant to take anything like hormone replacement therapy. I've heard there's a lot of health implications if you take that.
Okay, so that's a good concern you have. Thank you for answering my questions, Jennifer. I'll now like to examine you. I want to do a quick general physical examination on you, and I also would like to examine your tummy. Okay.
2 minutes remaining.
Yes, that's fine.
So, okay, looking at the examination findings which I have, so it appears that your body mass index is on the high side. By that I mean you're just slightly above the normal body mass index, which means you're a bit overweight. Are you aware about this, Jennifer?
No, I'm actually surprised because I do try to exercise. I actually walk daily.
Okay. But aside from that, the rest of your examinations are fine. The genital examinations and the other tests are quite insignificant. So I want to talk about what you're experiencing. This period you're going through is what we call the perimenopause. Have you heard about that before?
No, doc, please explain.
Okay, so because your age, you're 48 years old and you're just a few years away from the usual time in the life of a woman where she stops to see her period. And so before the age of menopause, some women start to experience symptoms like you mentioned, the mood swings, getting irritable, also feeling low in your mood, feeling anxious, and the hot flushes as well. So this is a sign that your body is gradually getting into menopause. Do you understand me, Jennifer?
Yes, I do. Thank you, doc.
Okay, so not to worry about this. Since you mentioned that you also prefer alternative options, I'm going to be giving you resources and leaflets so you can read about ways to manage this period. I know it can be quite difficult and it's quite challenging, the discomfort you feel, and also it's affecting your sexual life. So I want you to read more about lifestyle options that you can try. Please, you try to
Move on to
have
the
a
next
regular
station.
diet. Oh my goodness.
Thank you so much, Dr. Anate. And thank you so much, Dr. Natasha, as well. That was
Thank
good.
you.
All right, so let's talk about perimenopause. So why would you call it perimenopause instead of menopause, Dr. Anate?
Oh, because she's 48 years old, and so her symptoms have been for the past 8 months.
8 months,
It's not
yeah.
up to 1 year.
All right, exactly. So when it is 1 year, that's when you actually start calling it menopause, right? So
Yeah.
that is the important thing to know. But anytime after 40, so around 45 onwards, you can actually, menopause can actually start setting in. So anything beyond 40, you're already starting to think around menopause, perimenopause. But what if this person was feeling this same way where if she was in her late 30s? What would you suspect then?
I'll be thinking about premature ovarian failure
Absolutely. Premature ovarian.
or early menopause.
Yes, absolutely. That's good. Yeah. So in that, the very classic finding is, FSH will be high and estrogen will be low. Yes, absolutely. What are the, symptoms of menopause when you're thinking menopause? So she came in with hot flushes, mood swings. What are the other things that you are thinking of when you're thinking around this, along this line?
Most women who are having menopause symptoms will be feeling anxious and irritable. Some of them have weight changes as well, and it could have some acne, There's some different kinds of symptoms in different systems.
Absolutely. And they're also thinking along the lines of vaginal dryness. And so whenever you think menopause, so that means estrogen will be low. So what exactly happens in menopause? The egg, the ovary stops releasing eggs. So none of the, hormones will be there, like estrogen and all. So those are very important in bone nourishment. So you're thinking along the lines of bone health and vitamin D. So you want to protect those. There is a lot of risk of osteoporosis around this time. So you want to give them some nutritional supplement around these times, right? So that's also something that you need to think towards. But good job. And you also identified, so she said that she doesn't want HRT. So you should explain what HRT is, how it helps. So one thing, when you're actually explaining the diagnosis, explain why this happens, why, you feel this way because of the inadequacy of the hormones, because, at this point your ovaries are not functioning, right? They've stopped releasing egg. So to combat the symptoms, we would be replacing the hormones externally. So that is hormone replacement therapy, which is usually the way that we go about this. But yes, as you know that, as you have read, that there are a lot of risk associated with hormone replacement therapy. There are other ways also we can deal with these issues, right? So now you'll have to go down to every small issue, like hot flushes. What could you do for the hot flushes? You can actually try something to cool yourself down, expose yourself to the cold weather, or just put something cold on your face, that can help with that. Mood changes, you can talk about the SSRIs, right? And reduce triggers. So one other thing that you identified is that she has a very stressful life, right? So you need to give something towards, managing stress, right? So any activity that can help with managing stress, some self-care tips that she can use, some yoga, meditation, right? And also you identified that her BMI is high. That was good. Then you can actually tell her to try to exercise more, which can actually help with her cardiovascular risk around these times as well, right? So yeah, so whenever you identify something, like you see that this is off, you have to bring it back in management, because the reason why you've asked those questions is to understand any risk factors, and you understood a lot of good risk factors. So bring it back in management. All right, bring it back in management and give them, that this is one of the solutions of dealing with your condition if HRT is not something that you would, you will go ahead with. Also explain a little bit about what HRT is and why you would be giving HRT in this case. All right, that was
I
good.
think I had a lot to say in the management, but the time went out. Time ran out.
True.
Yeah.
That is absolutely true. Indeed, there is a lot to talk, because over here you're trying to understand. Main thing is you're trying to understand what is the extent. Does she have any bone pains and all, right? You're trying to understand what is the extent of the, the symptoms of perimenopause that she's experiencing. You're trying to understand if it's menopause or premature ovarian insufficiency, or if it's, perimenopause. So I understand all the different issues. If she says that she has vaginal dryness, there are all the other vaginal creams or pessaries that you can also offer, estrogen creams around those areas, right? So those are also additional things that you have to look out for, like what are the range of symptoms that she is having, right? So yeah, but I think you did a good job. That was a good presentation. All right, let's just quickly look at the performance. Dr. Mishi, were you able to mark?
Yes, I was.
Amazing. Let's quickly take a look. All right. So full name, age, acknowledge the emotion, ask for permission to gather more information, menstrual history, confirm last menstrual period, pattern before, irregularity, regularity, frequency, duration, pain, intermenstrual bleed, postcoital bleed, and age of menarche. Yeah, age of menarche is also very important when it comes to premature ovarian insufficiency there. Okay. Sexual history, discuss changes in the sexual activity. This will also go down usually around this time, right? Libido goes down. Obstetric history, number of children, and the details of delivery, if there were any issues with delivery. But yeah, I think you asked them. Social history, living situations, support network, lifestyle, including diet, exercise, smoking, alcohol intake, impact. Ask how the symptoms affect relation and daily activities, because you know she actually came because her husband said that she wasn't acting like herself. Right, so you need to understand the full impact of how this is affecting her. All right, presenting symptom, use Socrates to detail mood swings, hot flushes, dizziness, and genital discomfort. These are the main things that you have for, you know, menopause. Past medical history, medical condition, confirm medication, and family history. You know, any family members have been experiencing this issue around your, you know, age. Any, you know, female family member who has been experiencing these issues around your age, yeah. Check vital general physical examination and do genital. I actually gave you the examination, but unless you actually ask for the examination, they will not give it to you. So get into the habit of verbalizing what you want to see, right? Even though we
I
don't
think it was partially covered because I did say I'm going to check your vitals and
follow them, but
general
then
physical. I didn't get to the genital. Yeah.
yeah.
Hmm.
So when it comes to premature ovarian insufficiency, you'll have to do all those tests, you know, the FSH and progesterone there.
Okay.
Mhm. Management, increase your pace, try to complete the station before 2 minutes remaining prompt. Absolutely, I agree. You know, I mean, I would say a good way to actually get into this habit is try to see how long it takes for you to say, to ask 5 questions, you know, ask 5 questions and time yourself and see how long it takes for you. So then you will have like a rudimentary idea in 5 questions how long it's taking. So you just count the number of questions you're asking, and accordingly you can time yourself, because the only time you understand that, you know, how much time has passed is only when the 2 minute prompt goes off. And that's not very helpful because you only have 2 minutes to, you know, finish the rest of the station, so that might be very difficult. All right, explain symptoms most likely due to perimenopause, normal part of aging, symptoms managed, symptom management, lifestyle modification, regular exercise, balanced diet, stress management, cool sleeping environment. Yeah, sleep is also a very important thing when it comes to managing these symptoms. Resources, provide education material from Royal College of Obstetrician and Gynecology, Rock My Menopause website. That's also some you know, information that we found. Calcium, vitamin D supplements for bone health, that's very important. Non-hormonal options like CBT for mood swings, vaginal moisturizers, lubricants for genital discomfort. Medication options, discuss HRT benefits and risk, address concerns, ensure understanding of optional nature. So she said there's a lot of risks, right? That is one thing you can explore. Like, what have you heard about it? You know, like I understand that maybe the information that she has might be a misconception. You don't know that unless you ask her. So whenever they say that, yeah, I know that this is, you know, related to this condition, that condition, just ask them, like, what do you know about it? Like, could you explain me what you've read or what you've heard so that I can help you better, right? Follow-up, schedule a follow-up in 3 months, plan annual review, safety netting, advise urgent help if symptoms worsen, or new symptoms like postcoital bleed occurs. Right, interpersonal, show empathy and understanding of concerns, use clear jargon-free explanation about perimenopause and menopause, normalize experience and validate feelings. Yeah, exactly. So that's something that you need to incorporate into your thing, that you have to normalize the situation, that this is like a normal process or normal part of aging, you know. In this age group you experience so and so symptoms. Encourage open discussion about impact on relation, explore support mechanisms, respect you know, reluctance towards HRT, discuss all available options. Awesome. Yeah, I guess the marks checks out as well.